Go.
My name's Brock Lemon with the Norton Fire Department. Been doing this for about 9 years now. So most of the calls that we run on throughout the course of the year for EMS wise, a lot of them get dispatched out and categorized as general medical, which is anything from uh, just your general illness. You're feeling sick that day. They really can't pinpoint what the exact cause is, so they get toned out and coded that way. So it can be a lot of different things, and just things that they aren't exactly sure what category they fit in, but categorized as general medical. So that's why most of our calls get classified as that. The other kind of calls that we go on for the most part, actual injuries, any kind of trauma that happens, whether it's a fall. There's lots of fall victims. Elderly people fall quite a bit. Sometimes it's down staircases or ravines, so they tend to be they get categorized as that traumatic injury. So that's the other type of. There's the medical side, and then there's the trauma side. Then we go on a lot of behavioral and psychiatric disorders. More and more, they have us transport regarding or regardless of whether they're a threat to themselves or others. Even if they just wanted treatment, so we take them to the hospital, and that's the gateway for them to get help. So then you get into your three big medical ones that actually get broken down, which is respiratory, chest pain, and then LOC, which is the altered level of consciousness. Chest pains normally tend to be cardiac issues, so those are the ones that we try to treat and act quickly, get them to the cath lab. The next one is respiratory distress, which is just any kind of trouble breathing. We call it shortness of breath, respiratory distress. So those are the ones that people get really panicked over. Go on quite a bit of those. Can be anything from COPD or emphysema in the elderly patients or CHF to asthma and allergic reactions. And then the altered level of consciousness generally is more like our anything from diabetic issues where the people are active with their blood sugar. It can drop, causing that, or anything to the stroke and any kind of CVA emergency.